A shortage of primary care doctors has emerged as thousands of people gained insurance through the Affordable Health Care Act, according to a new survey. We know that more so here in Michigan than ever, as we have seen medical schools open up throughout the area, including Oakland University as well as Central Michigan University. Let's learn a little bit more about this from Dr. James Pinkney. We like to call him Dr. James. He is a medical expert for 1320 WILS at Fox News Radio. He's the founder and CEO of Diamond Physicians in Dallas. Dr. James, how are you, sir?
Good morning, Tony. Doing well.
Well, even before the Affordable Health Care Act, we had challenges, especially in the rural areas here in the state of Michigan, with a shortage of physicians. The Affordable Health Care Act has now made that challenge even greater. Tell us what you know of this new survey.
Yeah, that's exactly right. Unfortunately, the Affordable Care Act has granted access to health insurance to millions of Americans, but it's depleted access to health care, which is the most important point. Insurance premiums have risen, sometimes up to 300%. And unfortunately, doctors can't keep their doors open. So family medicine doctors, primary care doctors just can't make the numbers work when insurance companies reimburse them less than the cost of a test.
So physicians are going out of business?
Yeah, that's exactly right. Primary care doctors are closing the doors across the country. They're frustrated. They're exhausted. Their census is completely full, and we have to make a change. And that's what I've done here in Dallas, Texas with Diamond Physicians. We created an entirely new healthcare delivery model where the patient has direct access to the physician. So we charge a low monthly membership fee for unlimited visits, no copay, 24-hour access to your doctor. You have our cell phone, our email. You can Skype, FaceTime. It's unbelievable. And we include all of your acute medications and acute procedures. So if you cut yourself at 10 o'clock on a Saturday night, you come into our office and we stitch you up. It's all included for that low monthly price.
How are you able to do that and still make a profit?
Well, you know, in the insurance model, we collect about 17 cents on the dollar, and we spend 60 cents just trying to collect that money. So with overhead, employees, and all the staff required to file an insurance claim just to get about 17 cents on the dollar, it's a losing proposition. So we cut all that out. We don't take insurance. It's all cash pay. Kids are $45 a month. Adults are $95 to $295 depending on age. So for a couple $100, and that's for the entire month, you can come in every day if you like. You're receiving a value service for your money.
Do you receive any funding via the Affordable Health Care Act?
No, sir. I have no affiliation with any government payer, and that's how I can run the model how I want. I don't have any regulations, so whatever I can negotiate with a third-party vendor, that's the price I give our clients. So for an MRI, it's $400 instead of $4,000.
All right.
Scan $300.
Well, Dr. James, what are we going to do about this physician shortage?
I'm trying to motivate more physicians to go into primary care. I heard you guys have 2 new med schools, so we have to channel our energy towards our medical students and our residents and let them know that there's a better way to practice medicine. Unfortunately, they incur a ton of debt, and then instead of going to primary care, which is the lowest paid specialty, you go into a surgical specialty, which pays you almost 2 or 3 times more. So we have to change that, and my model actually increases the pay for primary care doctors, increases patient satisfaction, and will motivate more students to go into primary care so we can work on this shortage.
The survey by the Physicians Foundation found that 81% of doctors described themselves as either overextended or at full capacity, and 44% said they plan to cut back the number of patients they see, retire or work part-time, or close their practice, as you had mentioned, to new patients. That's something that's happened with myself. There's a great doctor in my community, and he's not accepting patients any longer.
I know. It's sad. Tell them to give me a call. Go to diamondphysicians.com, and let's figure out how we can save healthcare in America, because this is the largest crisis we've ever seen, and we have to do something. Huge physician shortage. Too much money is being spent, being wasted on the cumbersome middlemen.
Dr. James, we appreciate your time. Thank you, sir.
Thank you.
Dr. James Pinkney is the founder and CEO of Diamond Physicians in Dallas, Texas. He's a 1320 WILS and Fox News radio medical expert.